Hello guys, so now we shall be discussing regarding subarachnoid cisterns. Now what are these subarachnoid cisterns are that? We have got three important layers. Outer we have got dura mater, middle we have got arachnoid matter and inner we have got pia mater. Okay, so just below the arachnoid matter whatever space we have got, this is called as a subarachnoid space. Now within that subarachnoid space only we have got CSF, right? Now within that subarachnoid space there are some gaps. Okay, these gaps are nothing but called as cisterns. So with the picture I will tell you what are these gaps. So these gaps which are located below the subarachnoid region or below the arachnoid region are called as subarachnoid cisterns. Subarachnoid cisterns. So what are these subarachnoid cisterns? Now before to know what are the subarachnoid cisterns, first of all we have to draw the central nervous system from the lateral aspect. So this is your midbrain all the way like this, right? And next you have got your pons like this, and then you have got your medulla oblongata, and down all the way here you have got your spinal cord, right? Now where is your cerebellum located? Cerebellum is located on the back. Okay, now within this there is also what, there are also ventricles. I told you how many ventricles we have got. We have got 4 important ventricles. So from the side view you cannot see 1 and 2 ventricles. So from the side view this is the ventricle which you can see. This is both 1 and on the other side it is 2. And next both 1 and 2 ventricles join together, right, and they open into the third ventricle with the help of this opening called as foramen of Monro. And foramen of Monro will continue down as aqueduct of Sylvius. These things we have discussed already, right? So if you haven't watched the previous lecture, so watch that previous lecture first. Okay, so next important is that this will end up into the 4th ventricle like this. Okay, and finally we have got the canal, spinal canal, right? We have got the CSF in the spinal cord. So what are these ventricles over here? So here you have got 1 and 2 ventricles. This is called as a third ventricle and this is called as a 4th ventricle. And that opening which you can see is called as foramen of Luschka. Okay, so these are the things we have discussed. And second important thing is that you also know that attached to the surface of the brain, right, like this, you have got this particular, what is this thing which I am drawing right now? This is attached to the surface of the brain and this is called as your pia mater. So this structure which I am drawing right now, the red color thing which is closely attached to the surface of the brain, so this structure over here is called as your pia mater. After the pia mater, the next important structure you have got is a arachnoid mater. So how does arachnoid mater look? This is how it looks. So this is your arachnoid mater. Okay, and as you can see that arachnoid mater is leaving some gaps somewhere, right? It is leaving some very important gaps if you can see. So this is your arachnoid mater. Now let me label this first of all. So this layer is your arachnoid mater. This is your arachnoid mater. Now just beneath your arachnoid mater, whatever space you have got is called as a subarachnoid space. And within this subarachnoid space, what do you have got? You have got CSF. But there are some locations where the subarachnoid space is little bit larger. For example, you see this location, the subarachnoid space is more. And here also just in front of the pons, the subarachnoid space is little bit more. And next important thing, here also can you see that the subarachnoid space is more. And finally, here just beneath the cerebellum, also here you have got the subarachnoid space little bit enlarged, right? So these enlarged subarachnoid spaces are called as subarachnoid cisterns. So each one has got its own name. So what are the different names? We shall discuss it right now. For example, this particular thing which you can see over here, this is called as interpeduncular cistern. What is this? This is called as interpeduncular cistern. So where is exactly interpeduncular cistern present? That details will go on to the next video. We will discuss about those details. Okay. But now just name that this region is called as a interpeduncular cistern. Now after that, this cistern or this gap that is present in front of the pons is called as cisterna pontis. Cisterna pontis. This is called as cisterna pontis. And next important thing is that this cistern that is present near foramen magnum, right? All of you know that here we have got an opening called as foramen magnum through which the spinal cord exits out, right? So this opening near that foramen magnum, you call it as cisterna magna. Cisterna magna, okay? Or you can also call it as cerebellomedullary cistern. Why? Because this part is medulla oblongata, this part is cerebellum. So between the cerebellum and medulla oblongata, exactly here, right? So this is the part, this angle, at that angle you have got a cistern. So you can call it as cerebellomedullary cistern. Cerebellomedullary cistern. So two names have been given to that. And after that, the last cistern which we have here is this one. What is this cistern called as? This cistern is also called as cisterna ambiens. Okay, this is called as cisterna ambiens. This is called as cisterna ambiens, or you can also call it as a superior cistern. Superior cistern, and you can also call it as quadrigeminal cistern. Quadrigeminal cistern. So what are the things? Cisterna ambiens or superior cistern or quadrigeminal cistern. These are the three important names that are given. So how many cisterns do we have? First, what do we have is, we have got a cistern by name interpeduncular cistern. After that, we have got something called as cisterna pontis in front of the pons. Next, we have got something called as cisterna magna, and we have also got cisterna ambiens, which is also called superior cistern or quadrigeminal cistern. So these are the cisterns that are located over here. So first what we shall discuss is that we shall discuss about cisterna magna. Within this cisterna magna, why this space is really very important is that this space has got arteries. This space has got nerves also. So what are the nerves that are located within this cisterna magna, and what are the arteries that are located, or if there is any veins also, we will discuss all of them. Okay, so first let us put down the heading about cisterna magna. Cisterna magna. Okay, so cisterna in the sense three sisters, right? They are studying, three sisters, they are studying in three different classes. For example, one is studying in the 9th class, one is studying in the 10th class, and one is studying in the 11th class. Now what do you mean by 9th class? In the sense, 9th in the sense which nerve? So that would be your glossopharyngeal nerve. Glossopharyngeal nerve. Okay, and what is your 10th nerve? 10th nerve is your vagus nerve. Vagus nerve, and finally the 11th nerve is your accessory nerve. 11th nerve is your accessory nerve. So in this way we have got three important nerves over here. One, you call it as a glossopharyngeal nerve. Next, you have got it as a vagus nerve, and third important thing is your accessory nerve. So these are the three important nerves that are located over here. Clear all of you? Right? So just remember it as three sisters studying 9th, 10th and 11th. So these are the three nerves that are located in cisterna magna. Are there any arteries that are located? Yes. And these three sisters have also one more nature, that they are all the time very practical. They are very practical. Right? Now what do you mean by very? VER stands for vertebral artery. VER stands for vertebral artery. Okay, and when you write it as practical, P stands for posterior inferior cerebellar artery. Okay, what is this? P stands for posterior inferior cerebellar artery. Posterior inferior cerebellar artery. Okay, so Just remember this thing, that cisterna magna, you just can remember in this way by remembering this mnemonic. So 3 sisters, they are very practical and they are studying 9th, 10th as well as 11th. So you know the cranial nerves there, and very in the sense vertebral artery, right? Very in the sense vertebral artery, and P stands for pica. So these are the cisterns, these are the structures that are located within this cisterna magna, right? And one important feature about this cisterna magna is that this is, out of all the cisterns which we have, this is the largest cistern. That is why you call it as magna. Okay, so this is the largest cistern. And by the way, if someone asks you about the location, I already told you it is located near what? It is located near foramen magnum. It is located near foramen magnum. Okay, so these are some of the important points which you need to know in case of cisterna magna. The second important cistern we shall be discussing right now is cisterna pontis. Okay, so the second important cistern is cisterna pontis. So what are the structures or what are the arteries, whatever it is, they are located in this cisterna pontis. Now how do you remember this is pontis in the sense pond. Pontis in the sense pond. So who went near the pond? 6 friends went to the pond. 6 friends went to the pond. Okay. Now once they have gone to the pond, what they have done is that, see, if you see a pond, you are going to see a pond from the top, right? You are also going to see a pond from the front, right? And if someone is really interested to enter into the pond, he'll go inside the pond and he'll see how deep it is and what are the things that are present under the pond. So 3 ways you are going to look at the pond. First, you will look from the top. Next, you will go to the front, and there also from there you will look from the top. And the last important thing is you will dive inside the pond and look at the pond, right? So 3 ways these 6 friends are going to see. One is they are going to look from above. They are going to look from above. They are going to look from the front, that is the anterior view. They are going to look below the pond, I mean below the water, below. So what do you mean by above? Above is superior or inferior? Above is superior. So the artery will be superior cerebellar artery. Superior cerebellar artery. Next, A stands for what? Anterior. So it is anterior, inferior cerebellar artery. Anterior, inferior cerebellar artery. And next it is below. Below in the sense what? Basal. So basilar artery. It is basilar artery, and this is a very important question which was asked many times. Basilar artery, right? Now what do you mean by 6? 6 in the sense 6th pair of cranial nerve. What is your 6th pair of cranial nerve? That is your abducens nerve. Abducens nerve. So that is your 6th pair of cranial nerve. So what do you remember from this? You remember from this that cisterna pontis, in the sense 6 friends went to the pond. Okay, 6 in the sense abducens nerve went to the pond, and after going to the pond, what have they done? They have looked from the pond from above, from the anterior as well as from the below. So from the top when you look, this is called as superior. From the anterior side is anterior inferior. From the below it is basilar artery. Okay, so these are the nerves as well as the arteries that are located within the cisterna pontis. Now after these 2 cisterns are finished, cisterna magna and cisterna pontis, the next important cistern we shall be discussing is interpeduncular cistern. Okay, the next important cistern is interpeduncular cistern. Okay, now what do you mean by interpeduncular cistern? Within this interpeduncular cistern, there is only one structure you need to remember, that is your circle of Willis. Where is actually circle of Willis located? Circle of Willis is located, it is floating in the CSF, right? Where is the CSF? CSF is present in the subarachnoid space. So circle of Willis is present in the subarachnoid space. And the next important cistern we have got over here is cisterna ambiens. Cisterna ambiens. Now within the cisterna ambiens we have got a vein, okay, and this vein is called as great cerebral vein. Great cerebral vein. What is the other name for this great cerebral vein, which is also called as vein of Galen? Great cerebral vein is also called as vein of Galen. So these are some of the very important structures that are located. And one last important thing I'm going to tell you here is that I already told you that in diencephalon you have got something called as thalamus like this, right? And I also told you that you have got hypothalamus, which is your pituitary gland in this way. Let us say this is your anterior pituitary and this is your posterior pituitary. So obviously this pituitary gland is also covered by the meninges, right? So let us say that this pituitary gland over here is covered by this red color layer, and this red color layer is nothing but called as your pia mater. Okay, now after this pia mater, the second layer which you have over here is your arachnoid matter. This blue color one which I am drawing right now is your arachnoid matter. Okay, after this arachnoid matter, the next layer which I have got is a dura mater. Now one very interesting thing which you have to know here is that here do we have three layers of meninges? Yes, right? So what is the outermost layer? Dura mater. Next we have got arachnoid matter, and next we have got pia mater, right? But all of you know that just beneath the dura mater we have got a space, and this space is called as subdural space. All of you know that, right? So that is called as that is called as subarachnoid space. I'm sorry, subarachnoid space. That is called as subarachnoid space. Now within this subarachnoid space, what you need to have? Within this subarachnoid space you usually have CSF, right? Now what I'm telling you, just listen to this carefully, that here the meninges that are covering the pituitary gland, within these meninges which are covering the pituitary gland, there the subarachnoid space is absent. If subarachnoid space is absent, do you think CSF is present there? No. If CSF is not present there, even if in the ventricles the CSF level is increased, will that affect this pituitary gland? No. Why? Because in the subarachnoid space there is no CSF. So when there is no CSF, even if there is buildup of CSF in the brain on other structures, that will not affect your pituitary gland. So this is one of the important thing which you have to remember. Next important thing is that, let us say that this is your skull cap. Okay, this is the vault of the skull bone. After that, this blue color layer which I am drawing right now is your dura mater. After the dura mater, this red color layer which I am drawing right now is your arachnoid mater. After that, this green color layer which I am drawing right now is your pia mater. And deep inside here, you have got your brain in this way. Okay, so this is your brain substance. This is your brain substance in this way. Now, what I am trying to tell you? What I am trying to tell you is that, remember one very important thing, that, okay, let us first of all write down the things over here. So this is your skull cap. This is your skull cap, right? And this is your dura mater, and this one over here is your arachnoid mater, and the final one is here is your pia mater. Okay, now what I'm telling you is that outside the dura mater, see exactly this space which I'm talking. So where is this space located? This space is located outside the dura mater and inside the skull cap. So this space you call it as extradural space. What is the name of this space? You call it as, see, this space you call it as extradural space. Okay, next after that we have got, after dura mater, next we have got, just beneath the dura mater also we have got a space like this, you see, right? So this space is called as subdural space. Subdural space. After that we have got arachnoid mater, and just beneath the arachnoid mater also we have got a space like this, you see. This space you call it as subarachnoid space. subarachnoid space. Okay, so we have got three important things. One we have got is the extradural space, next we have got is the subdural space, and the third one we have got is the subarachnoid space. Okay, now what are the structures that are located here? This is very important. Let us say within the extradural space you have got an artery called as middle meningeal artery. Middle meningeal artery. Okay, now what I'm telling you is that whenever you fall down, right, whenever you fall down, what is going to happen? What is going to happen is that this middle meningeal artery can rupture. When this middle meningeal artery will rupture, patient will temporarily lose a consciousness. So there is loss of consciousness for a transient amount of time. Let us say my middle meningeal artery is ruptured and now I will lose consciousness for example, let us say 10-15 minutes, and again I will regain back my consciousness and I will be doing all my regular works. After some time again what will happen? After 1.5 hours again I will lose my consciousness. You see, this kind of losing consciousness and again regaining back to the normal state, this is called as lucid interval. Lucid interval. So in any question whichever you are answering, if you say, if the patient complains that the loss of consciousness was only for a brief period of time and again he regained consciousness back and he came to the hospital and explained everything. So that question is mainly asking about the extradural hemorrhage. Okay, so this entire scenario you call it as extradural hemorrhage or extradural hematoma. Okay, extradural hematoma, you call it as extradural hematoma. Next important thing is that you have got another important thing, that is subdural space. Now within the subdural space also you have got a vessel, and these vessels are called as bridging veins. Bridging veins. Okay, so elderly people, guys, this subdural space problems mainly happen to elderly people. Elderly people mainly who are on anticoagulants like varafin. Anticoagulants like varafin. What do you mean by anticoagulants? For example, varafin. What do you mean by anticoagulants, guys? For example, let us say anticoagulant is a drug which will not let the coagulation to happen. It means there are absolutely no blood clots happening in the body. So that care is taken off by this varafin. Okay. Now, why is elderly patient using anticoagulants? Maybe the patient is having atrial fibrillation. So later on you will study atrial fibrillation is normally heart pumps at a rate of 72 beats per minute. For example, if the heart rate, let us say it is 200 or 300, right? Heart literally is twitching like this. So when heart literally is twitching like this condition you call it as atrial fibrillation. Now in this condition what will happen is that blood clots will be formed, and these blood clots can even enter into the brain and cause stroke, right? It can even enter into the lungs also. So for that reason we basically put the patient on varafin. Or let us say patient has developed a deep vein thrombosis. There are clots that are formed in the deep veins of your leg. So from there what will happen is that from the legs the clot can come up into the lungs and cause a condition called as pulmonary embolism. And in this pulmonary embolism patient will immediately die if you are not taking any appropriate action. Okay, so for in these cases we give anticoagulants. Now when you are giving anticoagulants to an elderly patient, and if this elderly patient had a fall in the sense, let us say he had got some kind of head injury, now what will happen? These bridging veins will be damaged. If these bridging veins will be damaged, will there be blood clot formed in the brain? No. Moreover, patient is on anticoagulants, so blood clots will not at all be formed. So it will be continuously bleeding. So that kind of hematoma you see in elderly patients is called as subdural hematoma. Subdural hematoma. So that kind of hematoma you call it as a subdural hematoma. And final important thing which we have over here is beneath the subarachnoid space we even have got within the subarachnoid space, what do you have got? You have got CSF, all of you know that, right? So this is a subarachnoid space and here I have got CSF. So this is all the CSF that is located here. And floating within the CSF, what do you have? We have got circle of Willis. circle of Willis. Okay, let us say patient is having hypertension, high blood pressure. Okay, let us say patient is having a condition called as Ehlers-Danlos syndrome. Okay, Ehlers-Danlos syndrome. Let us also tell that patient is having a condition of, let us say, Turner syndrome. Turner syndrome. So these are the risk factors I am telling you. So whenever a patient is having hypertension, Ehlers-Danlos syndrome and Turner syndrome, in these patients the arteries are very much prone to rupture. So if a circle of Willis, right, if the arteries within the subarachnoid space they rupture, patient will have a very severe intense headache. Patient will complain that he never had such headaches in his life. So this is as if someone has very hardly kicked on his head. So that kind of pain the patient will have. Patient will have complain as if he's telling that this kind of headache is like a thunderclap headache. Okay, he never had such headaches in his life. That severely patient will have headaches, and what will happen? Patient will vomit a lot, and finally he will lose his consciousness. Okay, so such type of headache, such type of hemorrhage, you call it as subarachnoid hemorrhage or intracranial hemorrhage. Okay, so that kind of headache you call it as thunderclap headache or high intense headache, too much severe headache. So such type of hemorrhage you call it as subarachnoid hemorrhage or intracerebral hemorrhage. Subarachnoid hemorrhage. Subarachnoid hemorrhage. Okay, so what I'm trying to tell you is that this is very important, guys, not only for anatomy, for neurology also. There are three types of hematomas here. Outside the dura mater, you have got a hematoma called as extradural hematoma, where the middle meningeal artery is ruptured. So this is very important. They're going to ask you for anatomy point of view, which artery will be ruptured? Middle meningeal artery. And patient is going to have lucid interval. And next important thing, subdural space. Subdural hematoma is most commonly seen in which group of patients? Elderly, who are on anticoagulants. So which veins are damaged? Bridging veins, right? So this is your subdural hematoma. And next, subarachnoid space. So within the subarachnoid space, what do you have? Circle of Willis. And obviously such kind of hemorrhage you call it as subarachnoid hemorrhage. And how do you diagnose this subarachnoid hemorrhage? All these hemorrhages I will diagnose by taking a CT scan. For example, if the CT is inconclusive, right, patient came too early, the CT, I could not find much things on CT. CT is, I feel like CT is absolutely normal. Then what do? I do a lumbar puncture in case of subarachnoid hemorrhage, right? See, the artery is been ruptured. So this is your artery, right? You see now the artery is ruptured. When the artery is ruptured, all the blood will ooze into where? All the blood will enter into CSF. For example, if I do a lumbar puncture and take down the CSF, don't you think I will find excess amount of RBC within the CSF? Right? So CSF has usually 0 RBC. If I find many RBC within the CSF, it means that the blood is leaking into CSF. Why the blood is leaking? Because the patient is having what? Subarachnoid hemorrhage. Okay. So this is something, the clinical part which I wanted to tell you. But just let us have just a quick recap of all the cisterns here. So subarachnoid cisterns, there are basically 4. One is called as Cisterna pontis in front of the pons. Next we have got the interpeduncular cistern. Next we have got the Cisterna magna and quadrigeminal cistern, which is also called superior cistern, which is also called as Cisterna ambiens. Cisterna ambiens. Now coming to the Cisterna magna, this is one of the largest cistern and it is present near to the foramen magnum. Okay, so these two are very important questions. Next important thing is that 3 sisters studying, they are very practical. 3 sisters studying what? 9th, 10th and 11th. What is the 9th one? 9th is glossopharyngeal nerve, 10th is vagus nerve and 11th is accessory nerve. So very practical. V stands for what? V stands for vertebral artery and P stands for pica. When it comes to Cisterna pontis, remember it has 6 friends went to the pond, right? 6 in the sense abducens nerve went to the pond. when it went to the pond, they have looked at the pond from above, anteriorly and below. So superior cerebellar artery is on the top, inferior cerebellar artery is where anteriorly, and basilar artery is on the bottom, right? Next important thing, interpeduncular cistern, only one thing, that is circle of Willis. Cisterna ambiens, you have got great cerebral vein or vein of Galen. And remember one thing, that there is no subarachnoid space over here. That is why even in case of hydrocephalus, pituitary gland is not affected. And these are the three different types of hematomas which you have to know it at any cost, right? So these are some of the important things regarding the subarachnoid cisterns, guys. Thank you so much for watching my video. Goodbye.